Dr. Chris Pittman, CEO and Medical Director of Vein911 Vein Treatment Centers. And I'm just demonstrating an infrared device that actually is pretty awesome for detecting hidden vein disease. If you look at Traci, she's an AVP Pro beach volleyball player from Los Angeles. She's coming in here for treatment of her left leg today. She's had her right leg treated already. And we just thought it would be kind of interesting and fun to show the difference of what's going on. So if you do an ultrasound on Traci's leg, you're going to see a big varicose vein actually under the skin there. It's clearly not obvious clinically or to the naked eye. Traci's got pretty good looking legs, but she's got a lot of symptoms and some swelling. And so her left side's the untreated leg, and you can see the really bright white snake-like varicose vein hiding underneath there. So we're going to come to the opposite side if we want to do an attitude pose for me, Traci. Thank you. And this leg's already been treated. Clearly not nearly as bad as the other leg, but there's a couple of tiny pockets of probably little what we call tributary veins. But Traci's feeling great in her right leg. About a year after treatment in the right leg. So she's here again for left treatment. Let's go ahead and see both legs. Oh man, we'll see what's going on here. And again, you can kind of see the difference. Not a lot going on above the knee there, but if we come over here, she's got a big old pipe. And remember, vein disease, leak in the attic, flood in the basement. Poor Traci's got a flood in the basement. That's not really obvious, but we're about to turn off the leak in the attic in just a moment. Stay tuned. Traci Callahan, she's got perfect legs. Okay, there's not a sign of vein disease on her externally. She is a competitor, professional pro beach volleyball player, and every 7th day she takes off from training, she feels worse. Her legs feel worse, they feel heavy, sluggish, and she swells. And then we did an ultrasound, which shows objective signs of vein disease. And she had veins that were too big and leaking. So she had it all.
Hi.
How you doing?
Good. How are you doing, Dr. Pittman?
Awesome. It's game day. I'm sure you're familiar with that.
Definitely.
I ain't that nervous though.
I was just gonna say, hopefully you're not as nervous as I am at game day.
I am not nervous. And remember, this looks like major surgery, but it is not. It's kind of a walk in the park, and the only thing missing is probably some cocktails.
Dr. Pittman comes in, he's got all these, he's so animated, he's all these little jokes, makes you feel extremely comfortable.
All right, so Traci's here for a thermal ablation today. We've treated her right leg in the past, and she's doing fantastic.
Feeling great.
And it's just a blob of gel here. And we're gonna look under the hood with ultrasound. So we do have 2 sets of veins. Important ones are in the muscles. We don't mess around with those, but there's another set under the skin that is the ones that cause most people most problems. And they're like a pine tree. And our job is to get rid of the leaking pine tree, the whole thing. We don't want to leave anything behind. So thermal ablation, very popular procedure in America, and not that complicated to do actually for a physician who's trained to do it, is we get rid of the trunk vein. So we basically put a spaghetti device into the vein. We put a little anesthesia in there, and we superheat the vein, and we cauterize it, and we turn off the leak in the attic. And we're in. So we're going to take the thermal ablation device, and we're going to put it in the vein. This is going to feel like a butterfly in the vein,
okay.
Floating in the vein. Again, this procedure we're doing on Traci is extremely popular in America, and it's fundamental to turning off the leak in the attic. So we're going to turn off the leak in the attic for Traci, and her flood in the basement, her swelling, and her symptoms are all going to get lots better. And next time we'll bail the water in the basement. But this is the first thing you want to do, because you don't want to bail water in the basement. People might see a lot of varicose veins around the knee and below, but you don't want to get rid of those till you turn off the leak in the attic, right? Makes perfect sense.
You know, I understand varicose veins, they happen, and a lot of people have them. They don't like them because they're unsightly, but
Yep.
Is there medically something, like, is it dangerous to have varicose veins?
Well,
Or spider veins?
I have short answers and long answers, and the short answer is varicose veins are not normal, that's for darn sure.
Right.
And they've been poo-pooed by too many doctors for too long. And they can be dangerous. I would say the biggest danger is just ignoring them for long periods of time. There is an increased risk of blood clots, or the significant blood clots in our muscle, when people have varicose veins, or what's more properly termed venous insufficiency, or insufficient veins. So there's that risk, but I would say, you know, other risks are swelling,
Right.
heaviness,
Right.
burning, itching, pain, night cramps,
Right.
restless legs, all these kinds of things that interfere with patients' lifestyle and affect their entire psyche.
Right.
So it's way beyond just that risk of, you know, when you have stagnant blood sitting in varicose veins, it's going to tend to clot.
Right.
Okay, so we're going to be thermally ablating basically from 4 to 3, our zone here. And you can see the catheter in there. If you feel anything at all, you let me know, okay? It would be very unlikely, but possible. So tell us what kind of difference this procedure and the ultrasound-guided foam sclerotherapy's made on your other leg, the right leg.
Yeah, so for me, the biggest differences that I've noticed have been a lot of the times the days that I am not training, so the days I'm more sedentary, but there's no swelling. It's just my legs feel great, you know?
Awesome.
So it's funny.
Awesome. So we're all done. So Traci had her leak in the attic turned off, and so she'll be back in a few weeks, and we'll do the foam. We will get rid of those branches coming off the pine tree that you can't see. She has a big varicose vein under the skin going right inside of her knee and down, and that's still there. That's still alive, that's still kicking, but we've turned off the pressure going to that dilated vein, and then we're gonna kill it and put it out of its misery after we drop an F-bomb on it. So she's going to feel better after this procedure, but she'll feel even better after we get rid of all those hidden branches. So today, again, if this were a pine tree, which is another good analogy, we got rid of the trunk of the tree today, and next time we'll get rid of the branches with the foam.
For me, that was just really nice to know that, like, come in, get the ultrasound, see what's going on, get the diagnostics, and then being able to treat it right away. And then I was able to, you know, go back to California and move on with my life, which was great.
All right, see ya.